If you have sinus problems, you may feel a nasal blockage, but there are other conditions as well. Dr. Daniel Ganc of Boca Raton Community Hospital joins us this afternoon to answer your questions. Thank you so much for your time today.
Thanks for having me on.
What is a nasal obstruction or blockage?
Nasal obstruction or blockage is the feeling that you can't breathe either out of one side of your nose or out of both sides of the nose.
What are some of the causes?
The most likely common causes of this nasal obstruction are allergies. Actually, more likely than that is infections, which are mostly viral. Okay, most of the time these go away on their own, but sometimes they can progress into a bacterial or other infection. Other causes are polyps, or rarely there could be a small growth causing nasal obstruction.
When do you know, though, it's the same feeling, though, from whether it's an allergy or a polyp, so when would you know to see a doctor?
What I would recommend is general, what we call conservative treatment would be things like spraying saline sprays or rinses into your nose, and trying possibly some over-the-counter medications or antihistamines.
And if it doesn't work?
If the symptoms aren't going away, then come see a doctor. Most of the causes of nasal obstruction are very, very common, but there can be some unusual ones that you definitely want to make sure to see your doctor about.
Another question about a deviated septum, starting with what is it? A person wants to know, do I actually have one? What is it? What are some symptoms?
Well, the septum is the dividing line between the left and the right side of the nose. Everybody has a little bit of waviness to their septum, but a deviated septum that causes problems is one in which, from most likely a little trauma at some point that you may not have even realized, you lose the ability to breathe well out of one side of your nose. And the most common treatment is, again, just using saline rinses, but sometimes they need to be surgically corrected if the septum is really bothersome to the person.
And once again, you find out through
either failure of trying something at home that works, over-the-counter medications, and going to see your general doctor or your nose and throat doctor.
Sinusitis. We're getting a variety of questions about everything that you deal with on a daily basis. What is it and how is it treated?
Sinusitis is a sort of a general term for inflammation of the nose and sinus cavity. Most of the time this starts by an instigating factor like a viral infection. Sometimes allergies can be a part of that. Then the small openings to the sinuses usually become clogged, and that can cause pressure and pain in the face, and occasionally it can cause bacteria or fungus to kind of grow in those sinuses and cause even worsening infection and pain.
Now that we've covered a lot of territory with blockages, let's go back to some of them, like polyps, when you talked about an allergy or something. Is a polyp always not dangerous, or can they be cancerous, is what this caller wants to know.
Polyps in and of themselves are, by definition, non-cancerous. But the sensation of polyps can be actually caused by small growths that can be cancerous, but it's very rare. Most of the time, they're not a cancerous phenomenon.
We'll end on that note. Thank you, Dr. Ganc, so much for your time.
Thank you.
Boca Raton Community Hospital sponsors our expert and is also the sponsor of Ask the Doctor. Back with more in just a moment.